So I'm Ebony. I am the Assistant Director of Communications for the Student Special Interest Group of the Section of Women's Health. And today I am interviewing Carole Fortman. And can you introduce yourself, please?
Sure. My name is Carole Fortman. I'm the coordinator of the Women's Health Residency Program at Loyola University Medical Center, which is in the Chicago area.
Okay. And can you tell us about the basics of the program, like when it starts, how long is it, when are applications due?
Yes, our program starts the first week of January, and it goes for about 10 and a half months till mid-November. Applications are due October 31st, the year before it starts, which is basically like 2 months before it starts. And we do interviews in November and, make our decision shortly after that.
Okay. And how long has the program been around?
This is our third year.
Okay. And how many of your residents have passed the WCS exam?
Well, the first year, 2 years ago, our program graduated 2 residents who just passed it this year in 2017. Our graduate from last year's program is not taking the exam till March.
Okay. And how many residents do you take each year?
It depends. The previous 2 years, we've taken 2 residents each year, which seems to be a good number.
Okay. And can you tell us more about what the ideal applicant to your program looks like?
Sure. So mostly we're looking for somebody who is flexible, can manage a lot of different priorities at one time. Obviously somebody who has a strong interest in women's health, because this is a pretty big commitment to do this for a year. Good outpatient skills, because you are expected to work a 40-hour work week with a full schedule. So those are the main qualifications we are looking for.
And is there any experience that you look for, or do you accept new grads?
We do accept new grads. That specific experience would be just maybe having some clinical background in women's health, like either through an elective course in school or having some exposure during clinical rotations. It's not 100% necessary, but a stronger applicant would have those things.
Okay. And do you require any prereqs like the pelvic floor courses?
We do not.
Okay.
Usually we try to host a pelvic floor level 1 course from Herman and Wallace just before the residency starts. So if an applicant or prospective resident hasn't had anything like that, they have an opportunity to have that course just before it starts.
Okay. And can you tell us what your interview process is like?
Yes. So once all the application materials are in by the deadline, usually within that first week, we'll schedule an interview. So far, most of our interviews have been in person because we've had applicants from the local area, but we can do a phone interview rather than having somebody have to travel from out of state. It's approximately 1 hour interview with myself, our residency director, and our department director, and includes a tour of our facilities and about probably half hour, 45 minutes of actual interview.
Okay. And so can you tell us what is unique about your program compared to some of the other residencies?
Well, I don't necessarily compare ourselves to other programs. I would say what's unique about our program is that we are a large university medical center. While that might not be unique, we do have a very strong urogynecology department who is very supportive of physical therapy. So we have a good opportunity to interact with our physicians and have a couple multidisciplinary clinics that we consult with the doctors in our pelvic rehab program.
Cool. And do the 2 residents get to work together, or maybe with other residents of other programs?
Yes, well, the 2 residents do tend to get pretty close because they're kind of going through the same thing together for the year. We also have an orthopedic residency program at our clinic, and so they do get to work with those residents as well.
And what settings? You said you're at a medical center. Are there multiple settings that the residents work in?
Mostly they'll work in an outpatient clinic. they do have opportunity to work in the multidisciplinary clinics, which usually involve other physicians of different specialties, and our chronic pelvic pain clinic also has a pain psychologist.
Okay. And are there any other opportunities that are available within the curriculum, such as teaching or research or international, anything like that?
The other opportunities we do offer is there is a research component. Usually it's in the form of case studies, just because it is difficult to complete a research project start to finish in 10.5 months. There is opportunity if the resident chooses to observe surgery or, you know, different things that are testing that the different physicians may want to do, but that's not a requirement, and that would be on that resident's own time.
Okay. And can you tell us what the curriculum looks like for residents?
Yes, so once a week we meet for 3 hours, didactic and lab sessions, and just go through the various topics in our syllabus, and I can give you an idea of kind of what that looks like throughout the year. And also there's mentoring for about 4.5 hours per week, one-on-one mentoring with a WCS therapist.
And do the residents gain any like certifications also from the program?
No.
Okay. And then are there opportunities to work with men's or pediatrics or sports? Are those incorporated into the program?
Yes, they are. So we do include a pediatric voiding dysfunction and male pelvic floor in our program, and depending on the patient caseload, the resident can have opportunity to work with those patients. For sure, we have plenty of male patients should the resident choose to treat male pelvic floor. And we do occasionally have pediatric voiding dysfunction patients come through.
Okay, that sounds awesome. And what would you say the program's biggest area of growth is?
Well, we're a new program, so probably our biggest area of growth is that you know, we're constantly refining and improving it, you know, year after year. So we really try. I feel like, you know, the graduates of the program are very strong in their pelvic floor skills, for sure.
Okay. And then, so can you tell us about the area? So you said it's in Chicago. Can you tell us a little bit about the area, maybe like cost of living, or if the location of the schools has a lot of things around it, things to do and whatnot?
Sure. So the main medical center is located in Maywood, Illinois, which is a near west suburb of Chicago. It's a pretty diverse area demographically, which I think is a strength of our clinic, because you can work with many you know, different people from different socioeconomic classes. The area, I don't know, you know, how cost of living compares with other areas. It is a large city, so it's probably higher than more rural areas. I would say nearby towns that are attractive to live in would be Oak Park. Many therapists in our clinic also live in the city and commute out to the city. So I hope that answers your question.
Yeah, that's fine. And so what is the likelihood of being hired on as a full-time PT after completing the residency? Are there residents that prefer to stay and work? Are there opportunities for that?
Yeah, there is opportunity for that. So at most of our, or really almost all of our residents who have come to Loyola, either for the orthopedic or the women's health residency, who were not already employees, were hired during the course of their 10.5 months as a resident. So there is, I mean, advantage to that, because you can then have benefits once you're a full-time employee, and many do stay afterwards to continue working at Loyola.
Okay. Well, those are all my questions. Thank you so much for being here and answering them with me.